Throughout history, nature is our worst bioterrorist, and thus we must be indefatigably watchful and prepared. This concept is no better typified than in the recent outbreak of Ebola. Ebola is a viral illness whose recent outbreak, reported in March 2014, can be traced to the Guayaquil prefecture in Guinea. Due to this region's importance as an epicenter of trade, the disease quickly spread to the bordering nation of Liberia. In July of the same year, the Médecins Sans Frontières described the outbreak as out of control due to the virulent strain of the virus. Due to the disease's systematic transmissibility, Ebola poses not only a great threat to those who contracted the disease, but to also those who wish to treat it. Ebola has the capacity to infect members of the population through direct contact with the bodily fluids of an infected person. Due to the harmful nature of the disease, this recent outbreak is killing between 50 to 60% of infected people, with the WHO revealing that there have been well over 10,000 Ebola-based deaths. According to the World Health Organization, $1 billion is needed to stop the epidemic. Without urgent action, the opportunity to bring Ebola under control may be lost forever. In West Africa, the relatively few intensive care units are being overwhelmed and the infection rate is being exacerbated by the traditional superstitions surrounding disease control. Furthermore, as a continental business hub and travel pivot that sees thousands of Nigerians fly each day to and from airports across the world, especially in Europe and the US, Lagos is the sort of place where Ebola could rapidly spread and be taken abroad. In addition, the warning from the US Centers for Disease Control and Prevention can hardly be more ominous. The spread of the deadly Ebola virus, a spokesperson says, is just one plane ride away from reaching Western countries, as officials say 15 to 30 travellers are arriving from Ebola-affected countries each week. The primary reason as to why Ebola posed such an unrealised danger to Australia was its systematic transmissibility. Members of the population were infected when they had direct contact through broken skin, the nose or mouth, or through the bodily fluids of someone with Ebola. Furthermore, Ebola has the capacity to infect others through the transmission of seminal plasma for up to 3 months after the successful treatment of the disease. There is even evidence suggesting that Ebola can survive on surfaces for up to 6 days. If Ebola or Emergua was transported to Papua New Guinea, Timor or West Papua, do we think that those countries would fare any better than Liberia or Sierra Leone? Similar conditions exist: weak health systems, dramatic shortages of health workers, insufficient equipment, general mistrust of the government and traditional practices that might put people at risk. Thus, the potential for having Ebola on our doorstep is certainly a possibility. Secondly, another major reason as to why Ebola constituted a great danger and challenge to Australia was the level of unpredictability and the difficulty of containment. Due to the impoverished nature of Ebola-ridden West African countries, they lacked both the capital and facilities to ward off the virus. One BBC reporter claimed that the lack of resources has stymied the battle to combat Ebola, leaving countries teetering on the brink of collapse. Without adequate medical facilities and sterilisation, transmission of the Ebola virus continues to multiply. Furthermore, those most at risk from contracting the virus are health workers, typically from westernised countries, as they are required to work in exceptionally close proximity to those who are infected, and thus exacerbating their risk of infection. All it may take is a bead of perspiration for the virus to successfully migrate to a new host. Thus, health workers returning from West African countries pose a substantial risk to national security. For example, the case of Thomas Eric Duncan elucidates the unrealised danger that Ebola posed to those countries who deployed aid workers to help quell the outbreak. After returning from Liberia to the United States, he displayed symptoms of the virus 5 days after his arrival. If he had not been quarantined for that time period, he could have interacted with copious amounts of people, further amplifying the scale of the virus and successfully establishing Ebola in the United States. This scenario could have just as easily occurred in the Indo-Pacific region, which would have presented a substantial danger to Australia. Finally, there is no proven cure for Ebola. Experimental drugs such as ZMapp are in the testing stage, however their effectiveness is unproven. Thus, patients typically die from multiple organ failure and dehydration. For the prevention of Ebola within Australia, chief health experts met with border protection agencies on the 31st of July 2014 in an effort to plan the monitoring process of incoming passengers at our major airports. As a result, all incoming passengers were required to inform customs officers if they had been in an Ebola-affected country in the past 21 days. Furthermore, temperature screenings and infrared sensors were placed throughout security checkpoints. In total, 11 people had been screened for Ebola, all of which returning a negative reading. Why did it not happen? Well, with robust border protection systems, weekly national meetings on national response arrangements to Ebola and first-rate infection control mechanisms in hospitals, the Department of Health assures that the disease could be contained and would have had nowhere near the disastrous impact affected areas in Africa have seen.